All member states were praising China for what it did. China took action massively at the epicenter, at the source of the outbreak. It's a shutdown of the Wuhan city, and that helped in preventing cases from being exported to other provinces in China and the rest of the world.
Well, look, we have never before in history put masks on 1.4 billion people and looked at the effect. So this is something we have to study and learn from as we go forward. It wasn't our recommendation as WHO based on what we knew in previous diseases and outbreaks, but China did something differently. And, China has turned around the outbreak, and I would not quickly rule out anything that it did.
Chinese reporters and global reporters who have been at the epicenter have done incredibly good work bringing facts to people. Now, what are the problems? The problems were at the beginning with transparency. There were attempts to stop information from spreading that caused difficulty.
中共中央总书记、国家主席、中央军委主席习近平作出重要指示。
I think that from the moment that the Chinese government realized the seriousness of the disease and started releasing information, and then tried to tweak the information so that the methodology was generally considered acceptable and not political.
确诊病例2829例，新增重症病例186例。
The transparency level, the number of new cases, the number of people who've died, the number of people who've recovered. I think having reliable, consistent information is crucial. I think the United States could learn a lesson from the way the Chinese government has communicated clearly with one voice. I think one of the problems in the United States as the coronavirus pandemic now spreads is that there are many different voices, and there are not the trusted voices.
In a matter of days, Dr. Li Wenliang went from treating patients to becoming one.
Chinese authorities are launching a special investigation into his death and the public concern surrounding him.
Dr. Li Wenliang died of the infection. He was hailed as a hero on social media for raising the alarm about the coronavirus in the early days of the outbreak. The Western media elaborated on the public outpouring over the death of the doctor and accused Chinese media of hiding relevant stories. But what is missing is coverage of China's efforts to address the problem.
Dr. Li is the hero.
向李文亮医生的家属表示诚挚慰问。
国家监委成立调查组，就群众反映的涉及李文亮医生的有关情况，依法开展调查。
I really appreciate the way that China has exceeded the reporting in terms of transparency versus the reality of being accused that they're not being transparent. First of all, publicly announce the situation in Wuhan is very, very, very bad. Did they hide this? No. The doctors came rushing by the thousands to Wuhan to help. An incredible show of solidarity and unity. And such an emergency, and this is where we see the advantages of an authoritarian central planning type government, when they say something needs to be done, it can be done quickly.
My first impression when I landed, as I came out of the airplane into Beijing, I found this empty airport in a city of 20 million people. And it suddenly brought alive for me just a tremendous cost for the Chinese people, the Chinese economy, this terrible disease. Because when you walk into an airport like that, which is empty, it's a sudden and striking realization of what this disease can do to a country, to a capital city like Beijing.
交接文件标志着火神山医院正式交付。
No, all of it was being reported in the newspaper, clearly, all over the social media airwaves. And they even put a 24-hour live stream camera to show the hospital being built. And even still in the West, there were accusations that it wasn't being built, or that it wasn't really a hospital, or that it was just to show and propaganda.
While many Western media outlets failed to recognize China's efforts in containing the virus, Many also turned a blind eye to the solidarity shown by the international community.
Just like here today, we need to support each other and stay united. Let me be clear. There is no place in our country for discrimination driven by fear or misinformation.
Despite being a global leader, Trudeau's remarks only received minimal coverage in the Canadian and global press. These stories are rarely seen in Western media reports. Even though they had been put on alert for weeks, some Western countries act as though it was none of their concern.
Made the assessment that COVID-19 can be characterized as a pandemic.
Numbers are ticking up worldwide. From politicians to passengers, none is immune from the virus.
Increase and accelerator. L'épouse Sophie avait subi un test pour la
Others outside of the continent.
China is moving quickly to lend its hand and share its experience with the world. China has shared technical documents and diagnosis and treatment plans with more than 100 countries, over 10 international and regional organizations, conducted more than 20 technical exchanges, and sent expert teams to provide support overseas. The media coverage also appears to shift, to strike a balanced tone.
What even makes these measures democratic or not? At a time of crisis, shouldn't people be focusing on which measures are the most effective?
We see the drone shots from these cities and we think, ooh, lockdown, it looks terrible, there's no traffic in the street. That's not the point of what they did. They had to do that in order to introduce the measures they were going to take that were actually going to fight the epidemic. And that is testing, 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 testing. Find the virus.
The media coverage direction on this outbreak now is moving away from China and toward the rest of the world for obvious reasons. As of today, many people are finally, ringing the alarm bell and saying, okay, enough with the happy talk.
I think the tonality has changed already. Already I am seeing stories in American media saying that there are lessons that were learned in China that can be applied to this. I think people are learning best practices from what happened in China, medically, health, the importance of quickly creating health centers, hospitals, pop-up hospitals. The coverage has changed a lot. China is now on the downward slope in new cases.
A single tree cannot block the chilly wind, goes a European saying. Similarly, a Chinese proverb has it, many hands make light work. History has taught us the cost of playing the blame game and disintegrating in a crisis, and the wisdom of sharing and helping each other out. China has been sharing as early as the disease first broke out, but the Western media readily ignored the olive branch and spent time stigmatizing and playing the blame game. The negligence costs more loss in the pandemic. How many lives would be saved, and how much less loss could we suffer from the pandemic if we stop deflecting blame and sustain a good conversation?
We can work together, cooperate together, parallel intolerance, as much as we need to go forward in the global world. The requirement is maturity and wisdom to tolerate certain differences that are never going to change.
Coronavirus is bringing out the best and the worst in people around the world. I mean, the enemy is the virus. It's a global issue, and we're all citizens of the world as well as citizens of our own countries.
The virus originated from nature. China created a window for the whole world to get ready, and get ready fast.
Like it or not, the time for solidarity is now.